What's up, guys? Good morning. Welcome back on this happy Tuesday. And today we're going to be talking about kind of an interesting topic. We're going to be talking about disc injuries. Pretty frequently, you've probably spoke to somebody who talked about how they had a disc injury or they self-diagnosed. They said they have a slip disc. Discs don't actually slip. That's not an accurate term. Today we're going to talk about what happens to a disc and how you can actually find out appropriately and where you need to go after that. So first and foremost, an orthopedic test can give you some good information about a disc. An X-ray can show us the shape and or size, but really nothing except an MRI can give us a really true detailed idea of what a disc is doing. So today we're going to talk about using this disc, about what a disc actually is, what it will look like in an MRI, and who you need to see to fix it. So assuming this disc is what our discs look like, we want to picture the inside as like a jelly in a jelly donut, and then the outside as the outer side of the donut. The inside is called the nucleus, the outer side is called the annulus, or the annular fibers in a disc. Discs can really do about four things. The first thing we can do is we picture this disc kind of sitting on a plate. The plate would be the vertebral body. Any kind of undue stress on the disc can actually kind of warp a little bit the shape and size of the disc, and if any part of it goes over the borders of the plate, that's called a disc bulge. Pretty fairly common actually. About 85% of people will have disc bulges throughout their lives. They usually kind of spontaneously exacerbate and remit, so no really general concerns there. If you see it on MRI, it's probably okay. Further than that, discs can protrude, meaning that the inner part of the jelly gets stressed, it pushes the outside of the annular fibers, and it actually pushes against and warps the shape of it a little bit more so, and it can actually get into the nerve root, into the area where the cord is, into the part where the sheath is. It would be a little bit inflammatory and typically have some symptomatology. Further than that, a really stressful disc can push the inside of the jelly out to the outside of the donut and actually break through the outside, so that if you were to squeeze a donut, you would see the jelly kind of extending. That's called a extruded disc, which is a little bit more serious. Finally, we have something called a prolapse disc, so same idea, jelly donut. Picture squishing the donut and part of the jelly actually breaks off and falls outside of the donut. That's called a disc extrusion, and obviously a more serious thing. As these herniations or bulges increase in severity, symptoms can increase as well. They're not always correlated. Sometimes very asymptomatic people have more serious disc issues. Sometimes very mild disc issues can create a lot of symptomatology. What you want to focus on is, do you feel tingling in your fingers? Do you get motor weakness? Do you have weakness in your grip or with your feet? If so, you likely have some disc involvement, so please go see a physician and get an MRI so that you know how to treat it. Lastly, a really important thing is if you're getting severe motor deficiency, you can't go up on your toes, you can't go up on your heels, maybe your bowel bladder is really inefficient, you're noticing problems with that, then you definitely have a disc problem, most likely. Please seek the quickest doctor, the ER, to make sure that everything is okay. Otherwise, go see your chiropractor, go see your physio, go see your ortho. Typically, between the three of us, we can always work generally excellent together to get this resolved so that you no longer have disc injuries. You can bulletproof yourself and be the best version you need to be. If you have any questions about discs, disc injuries, feel free to reach us. Otherwise, the next video is going to be about disc exercises so that you can help yourself be a better version of you. Have a good day. Bye-bye.